This video does not condone the use of performance enhancement drugs, and the information provided here is solely for educational purposes only. Hey there, bodybuilder enthusiasts! This is your resident steroids connoisseur giving you steroid suggestions wherever I can. For today's recommendation, we have Winstrol, which can be administered orally or through intramuscular injections. This compound is pretty popular. Have you guys heard about it? Let me tell you the important notes about this particular product available in the market today. Winstrol is an anabolic steroid that is a synthetic derivative of testosterone, a product that is chemically known as stanozolol. It comes in a tablet form, which can be orally administered, or liquid suspension, which is an injectable. Injectables usually come at 30 to 50 milligrams per milliliter, while oral ranges from 10 to 25 milligrams. Winstrol, otherwise known as Winnie by some users, is particularly popular and making a buzz in the world of bodybuilding. And that's because of its powerful fat-burning ability and muscle-building effects. It also has anabolic effects, coming without a huge surge in water weight. This allows lean and aesthetic gains instead of bloated-looking muscles. The main reason bodybuilders and athletes love Winnie, it's because many of them find the Winstrol benefits outweigh the Winstrol side effects. Its versatility made it the second most popular oral steroid, behind Anabolic. Now that we're talking about versatility, Winstrol is also a prescription medicine that is used as a prophylactic to prevent the symptoms of hereditary angioedema and the severity of attacks of angioedema. It can be used alone or with other medications. Now you may ask, what is the best cycle or the best dosage to take with this product? Well, to start, there are different cycles and stacks you can follow to use this compound. But you should also note the intensity of the dosage you will consume. Winstrol is one of the most powerful steroids in the market there is, so it is essential to watch over the dosage and see to it that it will not lead to abuse. The standard cycle duration with Winstrol is anywhere between 4 to 6 weeks. Running a cycle longer than the suggested period can cause hepatotoxicity. Using cycle support supplements and products is also recommended to help protect the liver as well as the other organs. Winstrol is not a compound usually recommended for beginners due to its tendency to cause harsher side effects, but there is a protocol that is tailored for beginners. You use stanozolol in the course of the 6-week cycle, the first 2 weeks with 10 milligrams a day and the remaining 4 with 20 milligrams a day. It is also highly recommended to go through post-cycle therapy, PCT, with Nolvadex. It is recommended to consume 40 milligrams of said product for 15 days. According to modern-day bodybuilders, this cycle is considered a very light cycle, perfect for a beginner. However, if you get the chance to choose other compounds that have a milder effect, then you might consider it before Winstrol as a newbie. Now, for intermediate users who want to step up their bodybuilding game, this cycle is optimal for someone who's already taken Winstrol or milder steroids such as testosterone or Anavar. You will administer stanozolol in the 6 weeks of completing the cycle. It is recommended to take 20 milligrams a day in the first 2 weeks and 30 milligrams a day in the last 4 weeks of the cycle. With this cycle, you will experience enhanced muscle gains and fat loss. However, also take note that side effects will be more pronounced. But this is a properly dosed bodybuilding cycle, capable of dramatically transforming a person's body composition in a matter of weeks. The duration of PCT and the product and dosage recommendation are also the same as those for beginners. But if you want to upgrade your cycle to the optimum level, then you can try stacking Winstrol with other steroids like testosterone. The recommended dose for Winstrol is 20 milligrams for the first 2 weeks and 40 milligrams for the last 4 weeks. Along with this, you will consume 400 milligrams of testosterone in the first 3 weeks and 600 milligrams for the remaining 3 weeks. The PCT with this is HCG with a dose of 2000 IU every other day for 20 days and 100 milligrams a day for Clomid for 30 days. You will notice that strength and muscle gains will be significantly enhanced. It is a complementary stack because testosterone isn't a harsh steroid, thus it won't dramatically worsen Winstrol's already toxic nature. However, be wary of the side effects that entail this cycle. Gynecomastia is one of the primary concerns with this one, as well as lower androgynous testosterone post-cycle. The main difference between injectable Winstrol and oral Winstrol is that injectable Winstrol has far less side effects than oral Winstrol and can be administered up to 8 weeks instead of 6, since it is not liver toxic. Furthermore, injectable Winstrol seems to have a better effect on body fat composition since it is not diluted by the liver. On the other hand though, since injectable Winstrol is water-based instead of oil-based like other steroids, it can cause excessive pain on injections, and oftentimes if the injection spot is not clean, it can cause infections. That's it guys. This has been your resident steroids connoisseur saying strive for progress and not for perfection. Consult health professionals before considering anabolic steroids. Until then.